Why are more services needed to get optimum results for opiate-dependent persons? That's a good question. Historically, opiate-dependent persons have had very poor outcomes in traditional treatment. SAMHSA has identified that traditional treatment has only been 4 to 6% effective. What that means is that 90 to 94% of people going through traditional treatment have not had good results. SAMHSA, on the other hand, has identified evidence-based best practices through their research nationwide over many, many years. What they have found is that Treatment Improvement Protocol number 43 outlines a 70 to 75% effective methodology for treating opiate-dependent persons. Now, the components of MAT, medication-assisted treatment, are outlined in that Treatment Improvement Protocol 43. So what gets optimal outcomes? Well, number one, pharmacological management of withdrawals and cravings. In addition, adequate treatment of the underlying addiction, which would include both individual psychotherapy and group psychotherapy. Now, group psychotherapy is the primary venue for substance use disorders because of the group dynamic used in confronting the denial system of the addict. In addition to that, we have accountability and clinical safeguards. Without those, negative outcomes are frequently the case. So it's a safety factor. Tip 43, Chapter 12, addresses a whole chapter to co-occurring disorders. Co-occurring disorders are a major trigger for relapse. Opioid abuse masks pain, both physical and emotional. Unaddressed co-occurring disorders trigger self-medication or relapse. SAMHSA Tip 43, medication-assisted treatment, states the incidence of co-occurring disorders is quite high. Some studies show that 80% of women are trauma victims. So, what are the most common co-occurring disorders? Well, mood disorders, including major depressive disorder, anxiety disorders, including generalized anxiety disorder, post-traumatic stress disorder, social phobias, panic disorders, attention deficit disorder, schizophrenia, and other psychotic disorders, cognitive disorders, eating disorders, impulse control, pathological gambling, sleep disorders, and Axis 2 diagnosis includes personality disorders, like borderline personality disorder. Unless you are equipped to address these disorders, a referral is indicated in order to prevent negative outcomes from occurring. So why would you consider CREOKS as an agency to refer to? Well, CREOKS has a comprehensive outpatient mental health service system, including psychiatrists, nurses, psychotherapists, and case managers. All of these services are provided in 39 counties in eastern Oklahoma. Furthermore, CREOKS is associated with excellence in services. How do you make a referral to CREOKS? You can go to CREOKS.org, CREOKS.org, place a cursor on locations at the tab at the top, and select the appropriate location nearest your client. Or you can call 918-382-7300, or you can email dan.cross@creoks.org. We look forward to serving your clients.